इंडिया में हम अपने वेट से ज़्यादा दूसरों के वेट को लेकर कंसर्न रहते हैं. स्पेशली DC families never quite understand boundaries and often use आपने तो काफ़ी गेन कर लिया instead of hi or hellos to greet people both inside and outside of families. हमारा कंसर्न उनके हेल्थ से ज़्यादा एस्थेटिक्स पे होता है बिकॉज वी बिलीव फैक्ट कैनॉट बी ब्यूटिफुल एंड बाई चांस अगर जेन्युइन कंसर्न हो भी even then the focus is on the physical health. However, gaining weight, especially sudden gain of weight, can also be an indicator of declining mental health. Issues like anxiety and depression that often take time to have very recognizable overt symptoms are almost always linked to weight gain. The logic is simple. We often eat more when upset and junk food at that, and we also tend to not feel like moving much and take extra stress. All are factors that contribute to gaining weight. If you fall in the category of obesity, one or all of the things might happen. Quality of life. Men and women who carry significant extra weight often face problems related to physical and occupational functioning, both due to their size and chronic ailments. Being physically unable to do the things they love, such as attend fun events, travel, or visit with families and friends, can often lead to social isolation, loneliness, and more difficulty coping with life's hardships. Weight bias and discrimination. One of the biggest challenges for those struggling with weight issues is society's negative perspectives on obesity. अगर आप पतले हो, बोला तब भी जाएगा आपको कि अरे ढंग से कुछ पकड़ लो, हवा में उड़ जाओगे. But the negative bias is way more for overweight people as opposed to those underweight. Weight bias का मतलब होता है stereotypes or attitudes that define people with obesity as unattractive, lazy, and undisciplined. These unfavorable misperceptions can be widespread within families, among peers, in a workplace, and even in a healthcare system. These often lead to discriminatory behavior that affects a person's self-esteem, employment opportunities, and even the quality of healthcare they receive. और इसमें अब सोशल मीडिया भी ऐड हो गया है where pictures of you are put under scrutiny by many strangers. Poor body image. Weight bias and poor body image tend to go hand in hand. Patients may internalize society's stigma against obesity, which causes them to feel embarrassed about their weight and dissatisfied with their appearance. People who struggle with excess weight may also experience anxiety over being judged for how they look. Abuse. People who have gained a lot of weight suddenly or have generally struggled with weight issues fall prey to substance abuse more easily than others who don't. There's also research that says they are often more prone to sexual abuse by partners as well. The reverse is also true. Mental health issues can also result in weight gain. The link between obesity and mental health issue is not a one-way street. While it's clear that excess weight can take a toll on someone's emotional well-being, it's also equally true that mental health conditions may influence a person's weight. Here are some examples. Chronic stress, anxiety, and depression, as well as mental health conditions like bipolar disorder, may cause someone to use food as a coping mechanism. They might also make poor dietary choices, which in turn can cause weight gain. The serotonin deficiency linked with depressed mood, interrupted sleep patterns, and anxiety have been found to lead to carbohydrate cravings and weight gain. In other words, people who lack serotonin may self-medicate with food. Adults who are depressed may lack the energy or desire to exercise or take part in other activities. Leading a sedentary lifestyle can set the stage for weight problems. Some drugs for treating mental health condition can also result in weight gain among patients. तो इस cycle से कैसे बचें? Staying active. Exercise is a great way to boost natural depression fighting endorphins, lose or maintain weight, and feel better overall. That being said, exercising when you're depressed can be a challenge due to motivation. Taking small steps first, like even 10 minutes of daily exercise, 1,000 steps a day, or even a walk around your own room, if stepping outside feels too overwhelming, is a good place to start. Therapy. Therapy can be a wonderful approach for many issues. From depression to obesity, a therapist or psychiatrist can help you process the emotional factors both conditions cause. They can also help you embrace changes that will improve your quality of life. Sticking with your treatment plan. If your doctor has diagnosed either condition, they've likely prescribed medication, dietary changes, or made other suggestions for condition management. Sticking to these guidelines and being honest when you hit a speed bump is the only way to minimize side effects and other complications. However, all of this must be done as a multidisciplinary approach instead of isolated treatment. From a thorough baseline assessment of family history, risk factors, health, psychology, lifestyle, and dietary habits, to incorporating behavioral intervention programs and dietitians to monitor nutritional requirements, it should be done as a cause and effect situation. While we are at it, I want to also ask you to take a good look at your own biases and behavior towards obesity or weight gain in general. Instead of giving people labels because of everything that you've learned in your life about weight gain, try unlearning. Do not comment on anyone's weight. It is impolite and in general just to ignore. People often say that there's nothing better than tough love and bullying or humiliating others for their weight because that spurs them to lose weight. That may be so, but it creates a whole range of other issues and traumas. Kindness is always better than tough love. Do not be harsh on yourself when you gain weight or encounter difficulty losing it. Your physical and mental health can improve when you practice being kinder towards yourself and as well as others. Also, encouragement always works better than discouragement and bullying. माइंड ओवर मैटर का अगर ये एपिसोड आपको अच्छा लगा तो प्लीज़ इस वीडियो को लाइक और शेयर करें और हमारे यूट्यूब चैनल को सब्सक्राइब करें.